This podcast may not contain all of the information on the covered topic that is important or relevant to you. You should not place undue reliance on the accuracy, fairness, or completeness of the information presented. This content should not be used as a substitute for independent clinical judgment. Anyone with questions or concerns about the covered topic should consult with their healthcare provider. This HCA Healthcare podcast is intended to inform providers on our hospital's medical staffs, our employees, and other interested parties.
Hello and welcome to Self-Care for Caregivers, a wellness podcast series brought to you by HCA Healthcare. I'm Dr. Frank Drummond, the National Medical Director for Behavioral Health Services. Today I have the pleasure of being joined with Dr. Chris Ott, the Chief Medical Officer for HCA Physician Services Group. Welcome, Dr. Ott.
Hey, Dr. Drummond. Thanks for having me. I appreciate it.
Good. Today's topic is caregiver resiliency generally, but I was most impressed when I started to review some of the presentations and interactions that you'd had with your many physicians and physician groups and caregivers over the past 12 months, and really liked some of the things you had to say and some of the things that you were personally thinking about as this whole thing progressed over time. The first question I'd like to ask you is, what would 2021 Dr. Ott say to early 2020 Dr. Ott, knowing what you know now? What advice would you give yourself?
So knowing what I know when we went into this in 20, I think we want to look back and say there's a bunch of things that we would change. And I look back and I'm not sure I would have changed a whole lot. It's like coming out of the emergency department and seeing a patient come in through the front door on an ambulance, and then 3 days later, after they're an inpatient, learning the myriad of pathology that we didn't pick up in the ED, but the patient's alive and moving in the right direction. We had a lot of fear back in March and April. The numbers that were coming out of China, Iran, Italy, and then our outbreaks in the Bay Area and New York were extraordinarily dire. We were looking at moving into all sorts of restrictions in care. We were looking at being overrun in the hospital setting. And so I think that our fear, which was data-driven initially, was an appropriate level of fear, and we did an appropriate amount of planning. I think that set us up to, in hindsight, look to the general public and probably some in the industry as having overshot the amount of preparedness, and maybe the government overshot in closing down hospitals to elective surgery and chronic care. And by overshooting, the one thing that I would love to go back and fix is the idea that it got into the public's brain that healthcare infrastructure was toxic, that coming to a hospital, coming to a doctor's office, physically interacting could cause you potential harm. And I think that is something that the industry is still grappling with today. Making people comfortable with interacting with us and not having overshot that mark, I think, is something that I did learn from this.
That hits on a lot of levels. Really, there was a lot of, as a physician, people being personally afraid to interact with you and your family. I mean, a lot of our physicians mentioned that they were pariahs a little bit at home because they were going into a hospital, and that was such a fearful thing. I was talking to someone yesterday who actually told his family maybe not mention what dad does for a living for a while, like as a way of...
Yeah, and that can be, I think, a little soul-crushing and causes moral harm to caregivers, because doctors and nurses historically have never been thought of as plague carriers, as it were, right? I mean, we're going back into the Middle Ages, looking at how you would look at doctors wandering through villages and whatnot, and people being avoidant of caregivers. And when you are in the heart of responding to not only COVID, but all of the chronic and acute needs of a community, the moral harm that this has caused nurses, doctors, and anybody who works in physical healthcare infrastructure, I think, is something that can't go underemphasized.
Meanwhile, I would say collectively everyone's job got harder and different. And then to be treated like that on the back door, it was pretty depressing at the time.
Yeah, that's one of the things. So I do some talks to some business schools and to the MBA students. And one of the things I tell them is, not only was it that our infrastructure became toxic, right? So you are now somebody working in a place where people used to go and seek you out and seek your job location out to get better. There was some joy in that, and there was a calling in that. And now that became toxic to some. And then not to have the buy-in from the previous administration and government and buy-in from huge swaths of the general public. The virus was real, that the pandemic was real, that the pain that these nurses and doctors and techs and hospital folks and clinic folks went through was not real, when you see your fellow citizens not paying homage to all of the struggle that you've put in, I think it's difficult. It's like troops returning from Vietnam as opposed to returning from World War II. And that's not a great place for us to be. It wasn't a great place for us to be all last year, and it's not a good place for us to be now. I think that people are understanding better the scope of this as we passed 500,000 deaths.
True. It was very painful early on to see, for example, mask shaming going on and the politicization of the pandemic when it was so real and so much science, and everyone was working so hard to try to survive and thrive and retain what we could about delivery of healthcare services and our lifestyle, et cetera. It was tough. You interact with a lot of physicians in different roles and locations over times. What would you say the top 3 things you were hearing early pandemic from your teams?
Yeah, so the big things that we were hearing, and understanding for the listener that my area of HCA is the ambulatory space. So all of our 170 plus urgent cares and then our 1,300 physician clinic locations. I am all outpatient. Obviously, a lot of my specialists go into the hospital space. But the things we were hearing from the ambulatory space were a couple things. One was patients just stopped showing up. Communities went into lockdown. And so if you weren't going to the grocery store and you weren't going to a movie and you weren't going to church, you weren't going to your doctor's office. So we had a huge drop off, even though the offices were open, in ambulatory volume, which means people didn't get vaccines they needed. People didn't get their care gaps closed. People didn't come in for their annual wellness. And more importantly, they didn't get their health screenings for various, malignancies and other conditions, and they didn't get their chronic conditions managed. And so I think early on when docs saw this massive drop off in volume, they saw what was going to happen in the coming months and years for patients who had been undermanaged or underscreened or undertreated. And so we quickly pivoted to telehealth. We tried to get as many of those folks online as we could, recognizing that getting them physically into the office was not an option in certain municipalities and regions. And then the second thing that I remember that kind of just died off was there just wasn't testing capability. And that really hamstrung huge areas of the country. I mean, we're still bad at doing genomic variant surveillance, but we're great at testing now. There's a million places to go in the United States to get a COVID test. You can go on vacation and get a COVID test at your hotel to fly back into the United States. But that was a real stressor, was looking across the population, surveilling where the disease was, where spread was coming from, and whether your symptoms were a common spring cold or whether you had COVID and were going to carry it home to an elderly person or somebody with comorbidities. So those are the 2 things I think pop to mind when I think of last March, April, May, and June.
Remember the 2 and 3 week turnaround time for a test result? Trying to work with
Crazy.
that? It was
Crazy.
Literally impossible.
Right. And, we told people in that setting, quarantine yourself. And that's not a bad answer from a public health perspective or from a spread of disease perspective. But that's a damn hard thing to do if you live in a house with 4 people or 10 people, or if you're an essential worker. Go lock yourself in a bedroom for 14 days isn't great medical advice, social advice or otherwise, even though it's probably the best public health advice.
Just relating, so my world of psychiatry, in my world, the school closures and the lack of going to clinic, going for your checkup, we saw a lot of increase in, let's say, maybe routine, moderate adolescent depression, getting worse and worse and worse because they weren't getting the external monitoring by a teacher or counselors at school. The home situation was stressful. They weren't going for their regular therapy or other things. And everything presented so much more serious when it did present. And I'm sure it's true on the medical side as well.
Absolutely. And I think that as we look forward, obviously there's going to be huge retrospective studies and prospective studies on the outcomes that are coming out of this pandemic, right? I mean, speaking just of kids, how far have they been set back? How deep is the mental health need going to be in that population? What is the global economic impact? I mean, this is going to be years in the making for us to learn what we should have done or if we did the right thing. Speaking of kids not going into school, though, folks on this podcast probably are aware that the vast majority of employees in healthcare are women. Nurses, MAs, half of doctors, and they, as predominant caregivers across the U.S., when their kids were out of school, that created a huge labor issue, created increased stress for our caregivers. This was a difficult situation across the board.
Very much so. Going to now, when you talk to physicians or healthcare providers now in 2021, what sort of things are you hearing about now as far as what's on their mind or what do they find stressful?
Well, a couple things. The pandemic isn't over. So we've seen the three big upswings, right? We had the big swing in the coastal areas last spring. We had Texas, Florida, and a couple other markets in the summer, and then across the entire country, November, December, January, and we're on our way down. I think people are a little skittish right now, waiting to see what the variants do. Right now, we can test for variants. Our tests come back positive. They may have increased infectivity, but they're coming at the same time as some amount of herd immunity and certainly vaccination. And so I think there is this mixed trepidation because of the anxiety of the last year that is butting up against the reality that we have some tools to end this or some tools to drive this into smaller pockets or regional outbreaks. And so I'm sensing more positivity as we move into late Q1 of 2021. I'll say people are tired of wearing masks. They're tired of all of the physical distancing, all the stuff that we're doing in the offices and in the hospitals. It's just fatigue inducing. They get it. They know it's important. But I think people are looking forward for a time in late Q3 into Q4 where we can start pulling back a little bit on all of those other encumbrances to what was otherwise, what I'll say was an otherwise normal day.
When I hear people complaining about wearing a mask for 20 minutes in Kroger, I try to help them imagine wearing full PPE for 12 hours, for example. So our caregivers are very tired. It's hot and you breathe weird and your eyes get dry. It's stressful.
And that amount of physiologic stress just from doing that has psychological implications. You can't go through a whole day and be so burdened that you don't come out with no anxiety and no depression and no fatigue and no sleep issues related to it. This has high impact. And so the quicker we can get to a less stressful work environment for our caregivers, the better.
And I want to believe that the gradual optimism that you're mentioning is real. I mean, I think we're looking at real vaccines that are showing efficacy, et cetera. So it definitely makes me feel different.
Right. The thing that I am so positive about on the vaccines is they decrease death and decrease hospitalizations, right? Same with influenza vaccine. I'm concerned if somebody gets COVID. I don't want anybody to not feel well or to have to convalesce at home for a period of time. But if you get to zero or low hospitalizations and zero to low death rate of this, then the healthcare infrastructure can start to kind of sigh a little breath of relief and go on to regular business to meet the needs of all the other pathology that didn't go away when COVID came.
Right. So everyone's not a infectious disease specialist anymore, right?
That's right.
You can really focus on other things. You've given quite a few presentations about resilience and coping, et cetera. What have been the things that you find with audiences or people that you're speaking to that have resonated the most?
A couple things. And I think so I've given talks on this over the years in various leadership positions. And you don't want to spread any blame or make people feel worse than they feel in the middle of a pandemic or in the middle of an emergency, right? But in the end, it is each of our responsibilities to build up some bandwidth, to limit encumbrances in our personal life and our professional life so that we can respond when things like this occur. And part of that people sometimes bristle at, but part of that is a personal responsibility message that you don't take on debt you shouldn't take on, shouldn't buy a car you can't afford. If you get a dog during a pandemic, you got to take care of a dog after the pandemic when you may have to go to work. These are all individual decisions that adults are making. And so you've got to look at them, and each of these decisions can create an encumbrance on your future bandwidth. So make sure that you have bandwidth, make sure you have some savings, make sure you're not overstretched, make sure that you then can respond to pandemics, family emergencies, financial issues, you name it. That's on each of us to make sure that can happen. And obviously we all have variable ability to create bandwidth, but we should do it within our capability. That said, we as an employer have the duty to give grace to our individual employees. People get sick. People's kids get sick. People get flat tires. People get divorced. People die. And there are occurrences that we as employers need to see that no amount of bandwidth from an employee is going to not impact us if they have these real life situations, and they're all real life situations. So in that, I ask my employees to do their best to create appropriate bandwidth so they can show up to work and do their best. And in return, when they have issues that we need to give them grace for, they should never feel in any way that we are not ready to support them through that period of time.
I've been trying to work with leaders also understand how they can connect with employees during leadership rounds, et cetera, and talk about real things and some of these real problems in a safe way. So who's going to screen for severe burnout in an employee? Where do these people go? We've set up some confidential support lines. Those have been very widely used because people don't feel intimidated there, particularly by nurses, which I think was a good move. I would like for hospital CMOs to be able to make leadership rounds too. This is my personal opinion, but I've gotten some pushback that they should be able to have some real conversations with people. And maybe when they sense some of the things you're talking about, they're making some bad decisions, they can actually give them some guidance and leadership without getting them in trouble, for example.
So I personally don't think it's a fine line. I'll tell you that legal experts, human resources, and there are other areas that cringe sometimes when they hear me giving people advice or talking about expectations of my employees. And I cannot separate out the idea that having a realistic conversation about an employee's situation or about what I'm going to do as an employer or action I'm going to take in any way ameliorates risk or creates high risk. These are real people, real conversations, and these are unavoidable if you are going to work in an industry that is as heavy in human capital as healthcare is. We do it with patients all the time, and shame on a doctor if they don't walk in a room and have an honest conversation about test results, an honest conversation about diagnoses, about prognosis, and they avoid it because it's a difficult conversation or we don't want to make another person uncomfortable. There is a reality that we should all discuss, and that reality extends to our employees as well.
Some of the outreach that we do to physicians and surveys about how they like their job, one thing I see again and again, besides complaints about the electronic health record, they don't feel personally recognized by the facility or the group that they're working with or by the company. And what I find is when you have those conversations, difficult or not, as a leader, as a CMO, as a nurse manager, et cetera, that's what makes it sticky. That's what makes people feel like they're part of a team, that someone cares about them. If you hand them metrics all the time, it has a negative effect, a cumulative effect, if you don't balance that out with some real individual concern. So that's what I preach also. So we're on the same page with that for sure.
Absolutely.
But we have a lot of lawyers who don't think that way sometimes. How has your messaging evolved? We kind of covered this, but over the past 12 months, now you've been talking, because we deal with physician burnout for years, right? This is not new. And then now caregiver burnout, caregiver fatigue, resiliency, there's a lot of words. How has your personal message sort of evolved up to now?
I think that my messaging that goes out to our providers and then to my base of employees has morphed a little bit in the last year. I think I kept the same tone of messaging. I think the topics have changed a bit. They have morphed as the pandemic has morphed. They have morphed as the business has morphed. And I'll say that I have been focusing more in my messaging on things that the organization can do to bring us back to some normalcy. And be that in the EHR with vaccine interfaces, be it with pushing off particular required training so that physicians aren't overburdened in a given month with, quote, corporate requirements. If there are operational things that we should be doing that make the days of my medical office coordinators and practice managers and clinicians easier, I've tried to focus now on what the organization can do to return their lives to some more normalcy or some 2019, early 2020 normalcy.
I think a lot about the new normal. I think masks will be more of a part of our lives than they ever were in some certain situations from time to time. I'm not against that at all. I just think we have to think in different ways about the new normal. The education system really hurt a lot of people, and I think we should be sensitive to that.
Absolutely agree. I'll say that I'm also a huge proponent of human acclimatization to their situation. And people who have good mental health will acclimatize to whatever new situation they have in about 8 to 12 weeks. It's just new, right? The loved one dies, you change jobs, you move cities, your brain acclimatizes to that, and you function usually at your previous level in the new situation relatively quickly. I'm sensitive to folks who have major depression, anxiety disorders, all the things that have come out of this pandemic and increased those numbers and their ability to acclimatize. So I'm hoping that we're creating a future environment that doesn't require huge acclimatization to massive change. I think masks here and there are totally fine. I think booster shots for COVID going forward, maybe in perpetuity, totally fine. Front screening at the front desk, totally fine. I think there are a whole number of things that we will be able to get used to. There are some things that I hope we won't have to get used to.
Very much agree. From the psychiatric world, there's the grief process, right, as far as adjustment goes. And the biggest part to me is to get to that acceptance part so you can move on. I think everyone has experienced some level of trauma, and I spoke with a trauma expert in another episode, which was kind of interesting. But to be able to move on to that, that's a human trait. Sometimes it can be facilitated or helped, but yeah, that is a human trait. And I see your 6 to 8 month
I
part.
recommend everybody take their PTO or their vacation when they can. That's one thing that I'll say. And I'm prefacing that because I took some PTO 2 weeks ago and took a week off. And I read The Body Keeps the Score by Bessel van der Kolk. And it's a very interesting book on trauma and the treatment of trauma. And I'm not a psychiatrist. I'm a car crash emergency medicine doctor. But fascinating book about trauma and its effect on the U.S. population and the world population, and it being an under-recognized and under-resourced public health problem. Clearly, the pandemic has completely made this worse.
Mm-hmm. Agreed. That's an excellent book, and I would recommend it for everyone. We'll put a link to it in this podcast so people can click through and have access to it. What have been your two personal biggest challenges during the past 12 months?
That's hard to answer. I've kept a relatively positive attitude through this in that, I'm 48, I'm in good health. I did not have personal fear for myself in the pandemic. And I don't know if that just comes from being a doctor or being an emergency medicine doctor. Bad things happen all the time to people. I don't live in a generalized anxious state. And so one of the things that I've done is try to maintain that. The two big things that I've done, I make sure I schedule this every day. So I don't care if I have a night meeting or I have a meeting that goes over lunch. I have exercise scheduled in 6 to 7 days a week, and I sleep every night. And I realize that that is a luxury to some people. If you have children or squawking birds or dogs in your house, or you live in a loud environment, or there's just something else that's preventing you from getting good sleep. But physiologically taking care of myself over the last year has allowed me to be more present for the organization, for my employees, for all my AVPs and the folks who are really getting down into the trenches and making this place work.
Yeah, I would agree. I didn't pick up that habit until maybe 3 months in, but when I started working out, when I figured out a workout from home routine, right? Not being
it was hard.
Formerly an Orange Theory kind of person to try and figure something out that's entertaining and useful at home. But it made a huge difference. It does actually give you better sleep, and then you have much more optimism and energy during the day.
100%. And, this is something that when I look back on training in the late 90s, we were pre-residency rules. And so, you're on every third night, sleeping at the hospital, coming back in the next day, 8 to 12 hours later. I look back on that time and I think now that this should have been more stressful because I had all sorts of support back then. But that was way more stressful because of the physiologic stress and the sleep deprivation compared to anything I've experienced since then. And so I take very seriously making sure that folks are taking care of themselves so that they can be present.
Yeah, that's a good point. My biggest stressor has been I have 2 elementary school children. So just the obvious, right? But it's the entire world having the same issue. And I have it a lot better than some people as far as resources than, say, people in Central Africa, for example, who haven't had to, shelter at home.
That's right.
And that, for good or not, that's what's kept me from getting sort of feeling sorry for myself or whatever. I'm like, the whole world is experiencing this. Let's just make the best of it. They're healthy, and there's all these other things to be grateful for. But it was terrible, I'm not going to deny it was terrible, but it was just terrible for everybody. That some reason that kind of helps me feel better. I don't know.
That's right.
Do you think doctors are tired of getting advice from us?
So I try to stay away from giving my doctors medical advice or management advice. I have too many different types of specialists. I am not going to tell an orthopedist how to put in a knee or a neurosurgeon how to remove a tumor, and I stay away from that generally. Mm-hmm. The advice I give is general life advice, and it is broad, and oftentimes I'll narrow down the broadness to make a point. But I've tried to keep my advice to the field as organizational advice to make the operation run better. If the operation runs well and the clinics are open on time and the supplies are there and they're staffed appropriately, your day is better. And so I don't do a ton of direct messaging to just the clinician population. I message kind of globally to physician services. I should say I haven't gotten any negative feedback this year about the messages that we've sent. And in prior years, I'll say there were a couple people who would barb back once in a while. I've tried to be very judicious in that this year because of all the additional communication that's been going out related to pandemic management.
I was called Pollyanna at one point early on when someone asked me to give a talk, but I think I've tried to evolve away from I took it as a lesson, right? So, yeah. And I will say the reason we're talking today is I listened to one of your talks about resilience that was recorded based on feedback I had from multiple people from the work that you're doing. And I want to thank you for what you have done and let you know that it is making a difference and making an impact. It helps people. And I want to encourage you to do more of that because you're really good at it. So just know that. And really, I'm so glad to be working with you here at HCA. So.
Frank, thanks for the time, and I appreciate the questions and being able to participate.
Yeah, well, it was great to talk, and hopefully we'll talk again soon, and thank you very much, and that concludes this podcast.
All right, take care.